Hello, welcome to my submission for our Unit 2 project. So, my Unit 2 project is about Stickler syndrome. I knew a little bit about Stickler syndrome, but I didn't know a whole lot about it, so I was really excited to research it, and I'm really grateful that I was able to because now I know more about it, and honestly, it's a very interesting syndrome. So, I'm just going to get straight into my project. So the in type of inheritance of Stickler syndrome. So the main idea, so the inheritance pattern of Stickler syndrome is autosomal dominant. One copy of the altered gene in each cell is sufficient to cause the disorder. Autosomal dominant means that a parent can pass down that specific gene to the offspring. Some cases that can cause the infected individual that inherits the gene's mutation from, one infected parent. In some other cases, just can result from new mutations. So I have a pedigree. I know we haven't done much pedigrees in class, but so I'm not too familiar with the pedigree, how to read them correctly. But here's like sensorable deafness, hyperflexible joints, retinal detachment, myopia, and just uninfected. So here's the uninfected over here. And then all the other offsprings can result in the deafness, joints, retinal detachment, and myopia. So the main inheritance pattern of Stickler syndrome is autosomal dominant. So symptoms that affect the body of Stickler syndrome. So I have a picture over here as I'm reading the symptoms or symptoms that affect the body. So the mutations in certain genes involve the formation of collagen, which is the foundation for connective tissues. The collagen that is most commonly affected is joint cartilage and jelly-like material, which makes the face or can make the face look flattened, and that's how some joints and with people that are affected with Stickler syndrome have joint issues because of the joint cartilage not being molded and formed properly. So most diagnoses have a small chin and nose. They also can have flattened cheekbones and very prominent eyes. Some can have cleft palates, and cleft palates can affect their speech, breathing, and eating habits. And that is a very scary and can affect them with their quality of life later on. So that is a more severe case. And so that is kind of their physical symptoms. But for their mental symptoms or mental thinking that affects the body, because of the fact that Stickler syndrome is a disorder and not a disease, the affected individuals that have Stickler syndrome can live happy and joyous lives with their disorder, not affecting their mental state whatsoever. So the treatment methods of Stickler syndrome, the bottom line is there is no cure, which is very hard. As all of us wish there was a cure, there is not a full, just one cure for Stickler syndrome. But there are alternative methods to prevent further complications for some complications that may come with Stickler syndrome, like a cleft palate. So there is a thing called cleft palate surgery. This surgery is done by opening a child's mouth and rearranging the tissues in the mouth so the child can speak in a more fluent manner. And as you can tell by the picture, they're also going up towards the nose. That will help the child as they grow in their child being, and as they move on later into their lives, it will help them breathe, help them eat, and just like it says, speak more in a fluent manner. And surgery is often done on children. It can be done on adults, but mostly children, where their mouths are not fully developed, and it is easier for a surgeon to perform with the least amount of difficulties. So it is not impossible for an adult to get this surgery, but it is going to be way more difficult on the surgeon and the patient itself. So life expectancy and quality of life of Stickler syndrome. Let me move this over here. So Stickler syndrome does not affect one's life expectancy. However, symptoms such as hearing and vision loss can progressively get worse over time. So as each case is different for each individual, the quality of life depends on how severe the case is. If the case is more severe and the individual has to deal with significant hearing or vision loss, the quality of life for them might lessen as years go on. But with someone with a less moderate impact, they might enjoy life and have more happiness, so that it might not affect their quality of life as much because they're not worried about as many doctor's appointments and surroundings and just the um, reality of having vision or hearing loss. So they might not experience that. So most deaths are caused by ruptures, which I thought was very interesting, which can range from like organ ruptures to gastrointestinal. I hope I'm saying that right, ruptures, which I thought was very different and interesting. Like I said, obviously, some people that have Stickler syndrome just die of natural causes, but I thought the ruptures was very different, and um, on like you just don't find that in anywhere. Um, just like a person without Stickler syndrome. So in this picture, I know it's kind of blurry. Let me move my camera up. So in this picture, you can tell that their eyes are affected, their ears are affected, their joints, their oral and facial. And so all these things can be affected. And so it really depends on any individual and every individual. All right. So I have additional information on Stickler syndrome. So Stickler syndrome can now be detected before birth, which I thought was very interesting and very awesome that we're able to detect that really early on in a woman's pregnancy. So it is detected by a clinical geneticist if it is necessary and appropriate. So not everybody gets tested for it, only if it's in your gene pool. And I think that is a very cool thing. So if the results do come back as positive, the doctor may suggest asking for a second opinion through a prenatal doctor. I wasn't able to find why the doctors change from a geneticist to a prenatal doctor, but a second opinion is always great. And in this article that I found, which I thought was very interesting, and is in the year 2014, results at this time in the article were 96.6 accurate to show the possibility of a child being diagnosed with Stickler syndrome. So I thought that was very cool. I'm sure now, or maybe even as years go on, the it's already a high percent chance like accuracy, but it could go up to 100% in the future, which is awesome. And hopefully, technology and nurses are prepared and trained to find out other syndromes as well. So my references are on another document, which will be submitted with this at the same time. I want to say thank you so much for watching, and I hope you have a great rest of your day. Thank you.